We're glad to have you. We're going to talk about how respiratory disease looks in canines in 2025, which is different than it's looked since, well, it changed a little bit in 2023. It changed a little bit over the years. We're going to talk a little bit about the history, but respiratory disease, if you thought you knew everything there was to know about canine respiratory disease, I'm going to say there's probably some changes that you need to be aware of, and we're going to help you with. So we're going to go ahead and roll. So like she said, the Q&A box is where to put your questions, but Dustin will be putting anything into the chat that will be pertaining to coupon codes or products that we mention, or any other articles or links to things. We've also got an article that I've written that can go along with this, can be very helpful for you to go back and take a look at. So we'll have that available to people at the end of the webinar. So today's summary of what we're going to talk about is going to be, is there a new organism causing respiratory disease in dogs? And that's canine infectious respiratory disease, CIRD, which is kind of that category that we lump it all together. CIRD is kind of like kennel cough on steroids. You know, it's a little bit more than just plain old kennel cough, but it's sort of the thing that a lot of people are familiar with. We're then going to talk about canine influenza, canine infectious respiratory disease transmission, how it spread dog to dog. Should you be worried about your dogs? What we have for a new disease, how we make the diagnosis of old disease and new disease, how we prevent this, and what we do to go about treatment. So I think it's important that we go through a little bit of history, because over the course of the last 20 years, we've seen some significant changes in respiratory disease. Back in 2004, the greyhounds down in Florida at the racetracks ended up developing a disease that was further identified to be canine influenza H3N8. And we all know now that there's all kinds of influenzas with H's and N's and numbers and all kinds of things in them. So we've seen some changes, like avian influenza is H3N, H1N1. So we see, you know, all these designations, and it's helpful to know those things when we're talking about the disease, how we prevent it, and what we do about treating it. So in 2004, so 20 years ago, we saw this mutation probably come from horses, go to the greyhounds, and then it subsequently spread around the country. And then in 2014, there was a new strain that started to show up, and that was H3N2. And it was believed it probably came from dogs in Korea, but you know, we do the best we can in chasing down what the source of these were. And there are actually vaccines for both of these strains of influenza. However, according to the vaccine companies, we can still buy a bivalent vaccine that has both strains in it. Merck only makes the single strain, the H3N2, because it appears, at least for now, that H3N8 has disappeared. It's been eradicated. It somehow went away. We don't really understand again why, but it's gone now. So since 2017, there haven't been any dogs reported with that disease, but you can still buy the vaccine that contains both strains. So if you're concerned about this, that's something to be aware of. There is a vaccine company that has both strains, and then Merck has just the one strain. But then something else happened in 2023 and 2024. Late 2023, we started seeing reports in the news of this mysterious dog disease. So we're going to talk about what that is and how that impacts what you do in your dog world. So what are the causes of canine infectious respiratory disease? And like I said, this is sort of like kennel cough plus all the other diseases. So kennel cough is basically tracheobronchitis. It's an upper respiratory infection. So in the trachea and the bronchiole, it's not down into the lungs, usually causing pneumonia, but the back of the throat down to the lungs is where we see that cough initiated from a lot of these organisms. So canine infectious respiratory disease can be caused by all of these different organisms. Now, the ones that I put underlined are ones that are diseases we have vaccines for. And the other ones are that we have them, but we can't do anything really about them. So we have canine influenza, which we've talked about. And some dogs with influenza will end up with very severe pneumonia, as bad as hemorrhagic pneumonia. It can be very serious. We think H3N8 is eradicated. We see Bordetella, which a lot of people are aware of, and we kind of lump everything into the Bordetella category because a lot of the vaccines that contain Bordetella also contain parainfluenza and adenovirus. And we'll talk about all three of those and how we can prevent those in a few slides. There's a canine coronavirus, different than the COVID vaccine, different than the COVID that we see in humans. There's a mycoplasma that we know that causes respiratory disease in dogs. There's a streptococcus. There's a canine pneumovirus. There's a canine coronavirus and a rotavirus. And those are both, We see dairy cattle getting rotaviruses and coronaviruses, but they're typically more of a diarrheal disease, not a respiratory. Canine herpes virus will strike fear in the heart of many breeders because an adult dog with canine herpes virus gets a mild cough. But if a female is pregnant with a litter of puppies, or the puppies are infected shortly after birth before they're 3 weeks old, herpes virus is a fatal disease in newborn puppies. So we're very afraid of canine herpes. And although there is a vaccine in the European countries for canine herpes, we don't have one in the United States. As I understand it, the vaccine has to be at 90% efficacy to be past the USDA to approve a virus vaccine. And the virus vaccine for herpes did not qualify on that basis, is what I have been told. The other concern is, do we see enough herpes to justify the use of a vaccine? And if you're a breeder, the answer is probably yes. If you're not a breeder, the answer is probably no. Many people in the European countries, England included, I have dogs from Sweden. The breeders over there are very, very serious about doing herpes virus vaccines. And that, by the way, is the only vaccine we ever give pregnant female. Canine distemper virus, canine adenovirus, those are off the distemper adenovirus. So if we look at our vaccines that are DAPP, that's distemper adeno-parainfluenza, those are all lumped into one vaccine, and many dogs get on a basis every 1 to 3 years, depending on their exposure, and they get a series of that when they're puppies. So we don't see very much canine distemper in northern tier states, but the southern tier states in the U.S. sees distemper. There's a rotavirus. There's, of course, parasites that can cause respiratory disease. And what a lot of people don't have is leptospirosis, even though we primarily think of that as being a disease of the kidneys and the liver, can cause pneumonia. And then to top it all off, we can have co-infections. So it's not unusual for a dog that has one respiratory infection to have multiple, just like what happened during COVID in 2019, 2020. We saw a lot of people with coronavirus that also had influenza or had respiratory syncytial virus or had some other viral disease that made the COVID virus much more serious when they had co-infections. So those are important things to be aware of. The symptoms of canine infectious respiratory disease are typically coughing, sometimes sneezing, oftentimes runny eyes and runny nose, and a pretty bad cough. Like, it's loud, it's harsh, it keeps you up at night. It's pretty difficult to live with these dogs. And even though it's typically not a fatal disease to have these upper respiratory infections, it can be very difficult to live with because the dog's cough can be so severe that if they're sleeping in your bedroom, it can be pretty tough to get any kind of rest. And then we can see up to an 8% death rate with canine influenza because of the hemorrhagic pneumonia that it can cause, depending on the dog and how sick they get. So what are the other things that can make our dogs cough? So just because you have a coughing dog doesn't mean you should just grab a bottle of antibiotics and start them on it and call it kennel cough, right? You probably need to see a veterinarian if the dog's cough doesn't resolve the way you think it should. So we can see cancer causing coughs. We can see any kind of heart disease, whether it's a young dog or an old dog, they can have a cough because of the enlargement of the heart or fluids up in the lungs. We can see fungal pneumonias like blastomycosis, Coccidio, those are all fungal pneumonias that can cause a pretty significant cough. And typically on chest x-rays, those look pretty different, but it's important to know that if your dog isn't getting better, those chest x-rays can be very important. Aspiration, if the dog was trying to swallow food or water and they inhaled it instead, they can aspirate and they can have a cough. Certainly heartworm disease can cause a cough in dogs. So as heartworm disease becomes more advanced, the heart gets more and more diseased and fluid builds up and the heart gets larger, and those worms actually, although we call it heartworm disease, most of the worms actually live in the dog's lungs. So they get a pretty severe cough. Of course, dogs with allergies. So it could be something minor like allergies. It could be something life-threatening like heartworm disease that causes a cough. A lot of small breed dogs, especially if they age, have a collapsing trachea. And again, that's a loud honking kind of cough, similar to kennel cough. And it can be hard to tell those apart. And then, of course, irritants, if the dog is inhaling bleach that's not diluted adequately, or, you're spraying some of the quaternary ammonias in the kennel as a cleaner, sometimes those can cause irritation enough to cause a cough. So if your dog is coughing, I'm going to tell you that probably the smartest thing to do is grab your phone, take some video, and record how the cough sounds, what the cough looks like, so that when you do go to the veterinary clinic, you have some additional information that can be pretty helpful for people at the veterinary clinic to try and determine what's going on. So where do we see canine infectious respiratory disease being a problem? And these two maps come from 2004 and 2015. So they kind of give us a definition of what we saw with H3N8, H3N2, and then states that had a combination of both. So you can kind of see where these are, and it pretty much covered the whole country. I question whether Nebraska and North Dakota actually had no cases, whether they just weren't collecting samples and reporting it. But I think it's important to know that this was a disease that we saw all across the country. So no matter where you lived, you weren't really protected from being in some, remote part of the country. You were exposed to it. Of course, the population centers that are biggest are going to have the biggest number of cases, but that doesn't mean that it wasn't affecting every dog in the country. And what made canine influenza so dangerous? It was a new mutation. It was a brand new mutation. It was a disease that had never been seen in the dog population before. And this is information that came from Dr. Ron Schultz and Dr. Lori Larson at the University of Wisconsin. And Dr. Schultz, he's passed now, but at the time that he was still active with the dog community, he was pretty adamant that every dog should be vaccinated against canine influenza because it was a new mutation. Those dogs had no previous exposure. And like parvovirus, although it didn't cause vomiting and diarrhea like parvo, it caused up to 100% of the dogs that were exposed to it were susceptible because they had no inherent immunity. It was a disease that had been floating around for a long, long time. Remember, we saw parvo come into its own in the late 1970s, 78, 79, 1980. That's when parvo showed up. We saw the same thing happening with influenza. Is dogs had never seen this virus before. They had no inherent or innate immunity. And so many of these dogs were susceptible to picking up this infection, this viral infection. How do we contract? How does CIRD pass from dog to dog while coughing and sneezing? And dogs really don't have good hygiene. They go up to each other and they just cough right in each other's faces. They're sort of like kindergartners. They stick everything in their mouths and they run around and they don't really have good hygiene. They don't cover their mouths. They don't use a Kleenex. They're happy to share diseases amongst each other. When they bark at each other, it can spread the droplets that then the next dog can inhale. Shared food and water bowls, another really important source. So when you go someplace with your dog, don't share a water dish. If you're going to the dog park or going to the local, bar that lets you bring your dog, or you're going to a dog show, take your own water bowl. Do not let your dog share another water bowl with other dogs because we just don't know what that other dog might have. If your dog is sick, stay home. Or if you're going to the veterinary clinic, call ahead and let them know that you're coming in with a dog with a cough. So if you have a dog that's sick, don't go to a dog show, don't go to the dog park, don't go to doggy daycare, don't go to the groomer. Don't expose other people's dogs to a dog that's got a cough, sneezing, or some other kind of respiratory disease, because we don't need to spread this disease from one dog to another. If you have to go to the veterinary clinic because your dog is sick, call ahead, let them know you have a dog that's coughing. They may have you stay in your car. There's a typo on this slide. They may have you stay in your car, or they may have an isolation ward at the veterinary clinic where they'll want you to bring the dog into so that they are not sharing diseases among all the dogs that come to the veterinary clinic. So be thoughtful of other people that may have dogs that are coming in. How is it contracted? Again, show dogs, dog classes, dog shows. Any dog that goes socializing at the dog park. Maybe you have play dates with your dogs. I know my son and a friend of his have play dates with their dogs. At the groomer, of course, there's a lot of exposure at groomers and daycare. And of course, you can also carry that virus on your shoes, on your hands. So if you pet a dog someplace, you're down the street and you pet the dog and then you go home and pet your dog, you may have just spread that disease to your dog. And because this is a recent mutation, this is something that we have to be aware of. The dogs that are at greatest risk of developing respiratory disease are going to be the brachycephalic dogs, the dogs with the shorter faces, the pugs, the French bulldogs, the Cavaliers, the Shih Tzus, the Lhasas. Any of the dogs with the shortened muzzle are at increased risk because they already have some respiratory compromise simply because of the shape of their airway and the size of their nasal passages. So those dogs, if they do get a respiratory infection, are likely to get sicker than others. So just a little bit about me. I have been in practice for 44 years. We own 4 locations. I've got 2 books. This is a picture of my dear husband with one of our litter of corgis. This is Miranda, and our litter of puppies. And then we also have this little gal. This is Millie, and she is jumping. So please understand that their ears normally don't stand upright, but because she's in midair, her ears are up. This is a Danish-Swedish farm dog. We were talking about this just before we started. And she is breed number 202, Danish Swedish farm dog. So 202nd breed that AKC is accepted into full registration. So we'll be at Philadelphia, we'll be at Westminster, we'll be at all kinds of things. So they are shown in the working dog group. So if you're coming to dog shows, come find us because we'll probably be there. And this is the clinic that we have in Lamira. This is the clinic that Seaman built. We do a lot of work with breeders. So we do have a really lovely facility and an 8-doctor practice here. All right. So should you be concerned about your dog picking up canine infectious respiratory disease? And that, of course, like anything else, says it depends. It depends on the breed, which we've just talked about, the importance of the brachycephalics being protected, those shorter muzzles, shorter faces, more narrow nasal passages put them at increased risk of severe respiratory disease. So breed is important. Their age is important. The really young and the really old, just like in humans, we're more likely to get serious disease if we're babies or if we're elderly. So again, you want to protect those dogs to be, carefully so that they're not exposed to other dogs. And it's easy to say, oh yeah, well, I'm not going to vaccinate for this anymore because she's 14. And actually that's probably the dog that needs the vaccine the most. They have a new COVID vaccine this year for the people over age 65. So it is identified that people in dogs in certain age categories are at increased risk of disease. Their lifestyle makes a difference. Do you go to the dog park? Do you go to doggy daycare? Do you go to the groomer, dog shows, dog training classes, any of those things? If you're out and about with a lot of other dogs, you should be really aware of having your vaccines up to date. And vaccine status is absolutely essential. And if your dog overall is not in good health, if they're on steroids or on anything for allergies, they may have their immune system suppressed. If they have cancer, they don't have as strong of an immune system. So you want to be really careful that you're taking good care of the dogs that you have and not unnecessarily exposing them to other dogs that may share diseases with them. So what happened in 2023 and 2024? Well, Oregon was the home of the Golden Retriever National in October of 2024. And we had dogs that came back from that event that had influenza. We confirmed it at multiple veterinary clinics with multiple lab testing. We know that those dogs picked up some kind of an influenza. We're not sure which strain it was, but we know that they came back with influenza from those shows. And then it spread up the East Coast and it spread up the West Coast. And we had a pretty good pocket of it in the Chicago area as well. So that we know for sure happened. But in late 2023 and 2024, there was reports of a mysterious dog respiratory disease that no one had ever seen before. And this map shows you what the distribution was. And again, it kind of highlights those major population centers that the West Coast, the East Coast, and then, of course, Chicago, being in Illinois, Florida. I'm not sure quite why Colorado's out there in the middle of there, but that happened. So we saw a lot of dogs in those areas that had this mysterious respiratory disease, and it was pretty serious. People were very concerned about it because some of these dogs got really sick. So what happened is we didn't really know what it was, but I just was at the AKC Parent Club meeting in August, so a month ago, and Dr. David Needle from the vet school at New Hampshire was speaking, and his lab has been front and center in trying to chase down what this organism is. It's not a bacteria. They don't think it's a virus. They isolated a number of different DNA particles from this virus or this bacteria or whatever it is, and they think it's probably a mycoplasma. They are still working on trying to figure out the specifics of it, and I'm suspecting that he hopes they name it after him. I'm not sure if you want to have a mycoplasma named after you or not, but I suspect that that's probably going to come back, that it is a mycoplasma organism. And for those of you who are familiar with it, you may have heard about it for reproductive issues, but it's not really a bacteria. It doesn't have a cell wall, but it's not really a virus. It doesn't have to live in a cell. It's kind of this odd little organism that's somewhere between viruses and bacteria. So it's important that we're aware that mycoplasma is the suspicion. If you have a dog with respiratory disease, you go to the veterinary clinic in the first 2 days of their illness, the recommendation from Dr. Needle is to take a swab of the dog's throat and nasal passages, put it in a tube with some media in it, and put a tube into the freezer and hang on to it. And if your dog is still sick 7 days into this illness, he wants those samples because they're still trying to chase down this organism. So if you go to the vet, ask them before they start antibiotics or anything else, that if they will collect a sample, contact his lab and hold the sample for a week. And if it needs to be sent to them, that then you can submit it, because you have the ability, if you have a sick dog, and I hope you don't, but if you do, you have the ability to help with a research project in a way that is kind of unique. So you need to have special media. Many of the veterinary clinics will have that. They just need to take a swab, but it cannot be a cotton swab. It has to be a Dacron swab. So it's that synthetic, not cotton absorbent material. And you can get them from the diagnostic labs, collect the sample, pop it in the media, pop it in the freezer, and then hang on to it. Now, other ways that we go about diagnosing viral diseases and bacterial diseases in the respiratory tract are going to be to send a respiratory panel out to some of the diagnostic labs. Wisconsin Veterinary Diagnostic Lab runs a really good one, and a number of the state labs do as well. So you can collect those samples, send them in. It might take an x-ray if you suspect that the dog has pneumonia. They may want to x-ray the dog to see if it's fungal or bacterial. They may want to do a tracheal wash where they anesthetize the dog and run some saline down and out of the trach tube and collect some of that sample to see what the cause of the cough is. And then if it's suspected that the dog has a fungal pneumonia, and there's certain pockets in the country that see a lot of it, so those veterinarians are pretty familiar with this, there are urine tests, yes, urine tests, to find out what kind of fungal pneumonia the dog has. Those are run at Mira Vista Lab. And it's kind of like when they first started talking about urine tests for fungal disease, for pneumonia, I'm like, really? It's a urine test? Well, the answer is yes, it really is a urine test. So Mira Vista Lab in Indiana runs those tests, and they do a very good job with a very short turnaround time if your dog is sick with possible fungal pneumonia. This is how to submit a sample to the Wisconsin Veterinary Diagnostic Lab. So if you should need to send in a respiratory panel because your dog or dogs are sick and you need to know exactly what the cause of the organism is, you can certainly send them to a number of diagnostic labs, but this is the one that we've most frequently used because their turnaround time is really short and they have very good infectious disease testing there, better than many labs. And then again, this is Dr. Needle's contact information, and the article that goes with it is if you do have this potential disease, that you contact his lab through his email address. And this is the information for how to go about getting this. And again, this will be in that article that Taylor can send out to all of you after the program is over. This is what pneumonia looks like on chest x-ray. You can see the heart in the middle of that screen, and then out around it, the lungs should be completely black. But instead of being black, they're all patchy looking. That's what pneumonia looks like on an x-ray. What do we do about prevention? Well, we've talked about a couple things. First of all, stay home if there's something going around. So if you hear on the news that there's a respiratory disease circulating in your community, don't go, like, just stay home. Or if you go to an event, go in, show the dog, do the competition, do whatever you need to do, and get back in the car. Don't hang around for the whole day. Get in and get out. But we also have a really important tool, and that's vaccines. So I think it's really important that we do talk about disease control. As with any other disease, we want to be careful with our exposure. There is avian influenza that's still circulating. We're still seeing it in pet foods, especially cat food. So you want to be careful that you're not kissing your chickens. I know this is a really cute picture, but if this little chicken has avian influenza, this little girl is probably going to end up with avian influenza as well. So you want to be thoughtful. You want to be careful about the exposure. Be careful with raw pet foods because those are still containing the salmonella and avian influenza. And the Worms and Germs blog is an excellent resource. He updates this pretty much daily. It's written by a veterinarian up in Canada that does very nice updates on the information that you need to know about some of these infectious diseases. So it's a great resource. Good hygiene is always essential, and you cannot throw enough antibiotics at a problem to get away from having to use good hygiene. So if you go someplace and you've handled a dog, wash your hands before you touch your dog. Take off your shoes before you go in your house. If you have sick dogs at your house or in your kennel, then take care of the healthy dogs before you take care of the sick dogs. Wash your hands with soap and water. Alcohol-based disinfectants are not going to be good enough to get rid of some of these diseases. You need to get rid of the organic material on your hands, in your kennel. However you're doing that, you want to make sure that you're getting rid of the organic material with soap and water, and then you use your disinfectants. I think vaccines are an important thing to talk about at this point. It's, a lot of people really don't understand the process by which the vaccines are approved. On the human side, FDA, the Food and Drug Administration, approves vaccines. But on the veterinary side, FDA does our drugs, but USDA does our vaccines, and Congress is required to approve any new USDA guidelines. So you can see that this may move in slow and mysterious ways. And currently, about 40 to 50% of the dogs in the US are vaccinated for rabies, for distemper and parvo, for the most common diseases. And we know if only about 20% more of those dogs were vaccinated, some of these diseases would be completely eliminated, like canine distemper or canine parvovirus. We could completely get rid of these if we could get enough more dogs vaccinated. But we can't. It's like a lot of the other viral diseases we see in people. Polio, for instance, has primarily been eliminated. We've seen a resurgence of measles because people aren't vaccinating. So vaccines are really important. And the irony of vaccinations for humans or for pets is that typically the dogs that are vaccinated the most frequently are the ones that may be over-vaccinated in the process of trying to do the right thing and protect everyone. So what can we vaccinate for? We can vaccinate for canine influenza. We can vaccinate for Bordetella, parainfluenza, and adenovirus. And so it's important that you are vaccinating these pets that are in high-risk exposure situations. So who should you vaccinate? Any brachycephalic dog, bulldog, French bulldog, Cavalier, pug, Boston Terrier, any of the dogs with the short faces should be vaccinated because they're at increased risk. And I think any dog that's naive to this virus, which is almost all of them are naive to influenza because a lot of people aren't vaccinating for it, should be vaccinating for influenza if you're out and about with your dogs. And pretty much if your veterinarian says, oh, your dog's at risk of having Bordetella, you should give the Bordetella vaccine, you should say yes as well to the canine influenza vaccine. So if you have a dog that's in those high-risk exposures, grooming, dog events, any of those things, you should be vaccinating. So here's a little video on if you decide to vaccinate your own dogs, how to make up a dose of vaccine. So this is how vaccine typically comes in the lyophilized version. So a lot of vaccines come liquid, but not all. Some come with a diluent in the little vial, and then you take the diluent out, you put it into the other vial with the lyophilized cake of the vaccine, reconstitute it, and immediately you administer this vaccine to the patient. You don't let this sit around in your house for a couple of hours, or you don't let it, go back to the refrigerator. As soon as you make this up, you want to draw it back up into the syringe and go ahead and administer the vaccine. So that's how you make up a typical lyophilized injectable vaccine product. So pretty easy. But remember, you have to mix them together. I remember many years ago working at a catalog company, and we would get notes from people. This was before people used the phone. We had phones, but there were no 800 numbers, and people didn't want to spend the money for a phone call. And they would think that the vaccine with the lyophilized cake in it was a bad dose of vaccine that had dried up somehow. So that's not how it works. And this is vaccinating a cat. I know cats aren't dogs, but this is the picture, the video that I had. So we give it subcutaneously. Now, if we're going to make up a vaccine for the intranasal products, that's going to be a little bit different in that I usually use the ADT system, and that's this device here that does not require a syringe. Now, the Bordetella intranasal, parainfluenza, and parvo vaccine, as far as I am concerned, is the best Bordetella product on the market, better than the oral, better than the injectable. I think we get far better protection with this product. And if you accidentally give the intranasal vaccine, the one that's supposed to go as nose drops, as an injection under the skin, you can cause the dog to become very, very ill. So you want to be super careful. And that's why I use this product, is that I can't walk into an exam room and have a staff member that inadvertently made up the vaccine into a syringe, because some of these products do come with syringes or don't come with this ADT delivery system that uses a little squeezy thing. I don't want to accidentally give an intranasal vaccine as a subcutaneous injection. So super important. And this is my safest way to tell you not to have those things happen. So again, it comes as a lyophilized cake. You take the peel the top off of the bottle. You take the little ADT thing that has saline in it. You squirt that into the vial. Draw it back up. You mix it really well. Draw it back up. And this is a dog. I do know the difference between dogs and cats. And that's given as nose drops. So we just put a couple drops in each nostril. This dog is very cooperative. She's a real sweetheart. So that's a pretty typical way to give it. Now, I know it's easier to give the oral vaccine, but it doesn't protect against parainfluenza as well as the intranasal product. So you're much better off to just say to the dog, okay, for 10 seconds, you have to sit still, because we want to give them the best protection that we can. So that's how we make that up. So If you hear of an outbreak, you probably should get your Bordetella vaccine, your combination Bordetella vaccine, which should be the Bordetella, parainfluenza, and adenovirus, and you should get an influenza product. Does that protect against this new organism? No, we don't have a vaccine against the new organism, but it will help protect your dog by keeping them from having other respiratory diseases that can make the new organism make them sicker. So, like I said, there is an intranasal, there's an injectable, and there's an oral vaccine. But in my hands, we have had far better success with giving the intranasal 3-way product than we have with the oral or the injectable. We've had better protection for our dogs. So, in my humble opinion, vaccines in humans and animals have probably saved more lives than any other medical advancement, more than cancer treatment, more than anesthesia, more than antibiotics, because now we can take diseases and completely prevent them. So because we can't walk around wearing masks, or our dogs can't walk around wearing masks all the time, it's important that we're protecting them with vaccines and that we're getting the best that we can from those products. So vaccinate for the dogs that are at risk. So what happens if you have a dog with a respiratory disease? Well, you probably need to make an appointment with your veterinarian, go in, see if they're sick enough that they need to be on fluids, if they need to be x-rayed. With viral infections, all we can do is supportive care. We don't have antiviral drugs that are effective against respiratory disease, at least at this point. We do have parvo, but that's not this disease. So we don't have a monoclonal A antibody treatment yet for any other diseases besides parvo. So with viruses, we give them supportive care, which means fluids. It means softening their food so that they're willing to eat. We want to keep them well hydrated. So if they do have a cough, it loosens up all the mucus that's in their chest and they can cough it out and get rid of it. And then some dogs are going to benefit from a cough suppressant and some should not. If it's a dry, harsh, non-productive, self-perpetuating cough, a cough suppressant is a good idea. If it's a productive cough that they're coughing up phlegm, then you probably don't want to use a cough suppressant because you want to get that material out of the lungs. Most coughs with kennel cough are a dry, non-productive cough that's pretty difficult to live with. So a cough suppressant in many cases can be really useful. And then if they have a bacterial infection, you want to use the supportive care of the fluids and the cough suppressant, but then you may also need it to use an appropriate antibiotic. That being said, the American Veterinary Medical Association and the AKC are currently collaborating to get more people on board with antibiotic stewardship. And basically what that means is you shouldn't be using antibiotics unless you absolutely know that you need an antibiotic. We're concerned that we're going to see increasing numbers of bacteria that are resistant to antibiotics, and that's going to affect not only our pets' health, but that of our livestock and that of ourselves. So if we have dogs in our homes that have bacterial resistant diseases, they can spread some of those to us like MRSAs, and that's a big concern. So do not just reach for an antibiotic because your dog has a little bit of a cough or a little bit of a sniffle. Contact your veterinarian, see if there's something specific that you can do that would be a more appropriate treatment. Fluids are absolutely essential. You can give them subcutaneously. We do have all of these supplies at Revival. We have the oral electrolytes that you can give them to take if they are willing to drink, and that helps keep them hydrated. And our Puppy Light and our Kitten Light products are basically a chicken soup based product, so they taste delicious. If you have to give fluids under the skin, you'll need a bag of fluids. You'll need either a butterfly injection set, which is a winged infusion set, or needles, and then a tubing to get the fluids out of the bag and into the dog. So keeping them well hydrated is really important. And I think a lot of people underestimate the value of fluids for sick dogs. They feel so much better, they eat better, they drink better, they feel better when they're hydrated, and it helps loosen up the debris. So if they do have a cough that needs to have productive stuff coming out of their lungs, you're going to improve the recovery rate of these dogs with fluids. Additionally, we have the cough tabs, which are made by Creative Science, which is now one of our Revival family products. You can buy these over the counter. It's dextromethorphan and guafenicin that will help to break up the cough and help get rid of some of the debris that's down in the lungs. So a great product to have. And I'm just going to throw in here that this product expiration date little thing on the bottom of all of our web pages, I think this is kind of interesting, that you can click on that. And it will take you to a spreadsheet that tells you the expiration date of every product in our catalog. So if you're buying something and you don't expect to use it up in the next few months, check the expiration date. And that can help you to decide if you want to buy a small bottle or a big bottle of something, or how many bottles you want to buy of something. So use that tool. It's on every one of our web pages. And all you have to do is click on it. It brings up this giant spreadsheet, but they're all alphabetical. So you can very quickly go in and say, oh, cough tabs, the date on that is 2028. I'm going to buy a big bottle. So take a look at all those before you make your purchases. And then, of course, antibiotics are useful in bacterial respiratory disease. Oftentimes we'll use azithromycin, we'll use Clavamox, we'll use doxycycline for mycoplasmas. But make sure that you are using a veterinary prescription product and that you are giving it at the dose your veterinary prescribed at the right length of time, that you don't say, well, jeepers, as long as he's feeling better, I'm going to stop the antibiotic. If your vet said to give it for 14 days, you need to give it for 14 days. So follow the instructions. And remember, Revival has a very robust pharmacy with pharmacists that are available to help you with any of the orders that you have from your veterinary prescriptions. And then if you have puppies or adult dogs with a cough, you can nebulize and use this handheld nebulizer that Puppy Warmer has in our catalog. It takes basically saline, it's like a vaporizer, but you can run this closer to the face of the dog. If it's a little puppy that's still very small, it might be in the incubator, and you can help to break up the cough a little bit better by keeping them well hydrated by breathing in these mists. So these nebulizers can be very helpful, especially in the brachycephalics that have a tendency to have more nasal congestion. So we have all of our information here in our catalog. We have this nice QR code that helps take you to all of this information. Remember, we have line of horse products as well as the bird supplies and dogs and cats. And then, like I said a little bit ago, we have a complete pharmacy with pharmacists, and they are amazing people that are really very useful in helping you figure out what you need and how you can get prescriptions from your veterinary clinic for getting the drugs that you need for your pets. And it doesn't just include antibiotics, it includes almost every drug, including allergy drugs that you may need for your pet. Here's our code again. And then we have these bundles that have the QR code, and these will help kind of, these bundles are a little bit discounted, and they help make sure that you have your complete project solved so that you don't just have, oh, I need to have a litter of puppies, what do I order? We have some additional information. So Q&A. I think we've got a little time for questions and answers. Caitlin, got anything for me?
Yes, I have a few questions on if Cytopoint injections will lower the immunity to canine infectious respiratory disease.
Cytopoint does not. It's a monoclonal A antibody. Apoquel, Zenrelia, and prednisone, those are the oral medications. They may cause your dog to be immunosuppressed and more likely to pick up a respiratory, but Cytopoint should not.
Thank you. I've got another question here. Do any of these diseases cause spontaneous pneumothorax?
Probably not. A bulla is what's required. So a bubble on the edge of the lung lobe is what's required to have a spontaneous pneumothorax. I've seen it with parasites. I've seen it with trauma. But I don't think anybody's reported spontaneous pneumothorax with this kind of infection.
Okay, thank you. And I have one. If we give the intranasal vaccine, is it for both Bordetella and canine influenza?
No. The influenza is injectable, so you have to buy that as a separate product. You can buy the monovalent or the bivalent for the influenza, and then you need to get the intranasal as well to get full protection.
Okay. And the last question I have here is oh, I got a couple more. Is puppy light, can that be used in adult dogs?
Oh yeah, and they love it. It, like I said, it's chicken soup based. It's a really good way to get your dog to drink if they're not feeling well. It tastes really good. I've tried it. It tastes really good.
What is the best oxygen concentration for a sick puppy, and what is a good rate for the oxygen flow?
Well, it depends on the size of your incubator unit or how you're administering it. So there's kind of a broad range. The Puppy Warmer oxygen concentrator typically delivers between 0.8 and 1 liter of oxygen. So I would use that. But remember that the incubator is really for little tiny puppies, not for bigger puppies. So make sure that you're using it correctly. And if you have any questions, you can talk to Ken at Puppy Warmer for additional help.
Thank you. Would a humidity in a kennel increase the likelihood of an upper respiratory infection?
If it's too dry or too humid, yes. The typical humidity that we want, the range should be between 45 and 65%. So you want to try and keep it in that range. Now, if you live in Florida, you might not be able to keep it below 65% just because of the weather. But if you have a particularly dry area, if you have, the cold winters that we have in the north, you may want to run a vaporizer or humidifier to keep the dogs from being so vulnerable to picking up respiratory disease. I used to have a Labrador, and as she got older, every single day that it was below 20 degrees, she would come in coughing. I don't know why 20 degrees was her trigger. it's none of my other dogs would ever cough, but that temperature for her was really tough.
Okay, thank you. I have a question here. Are French Bulldog puppies with swimmer syndrome even more prone to getting these diseases?
Probably because they don't move air as well. So you want to try to prevent that swimmer syndrome. I typically will either use egg crate mattress underneath the puppies for bedding, or I've started using a stuffed animal that has like the octopus with long legs so that they can curl up and get up off of the flat surface. Because the flatter surface that you have them on, the more likely they are to have a flat chest. And if they're not moving air well, because their chest isn't shaped correctly, yes, they are more likely to pick up respiratory disease. So keeping them from developing swimmer in the first place, and it's a little hard, but you just go to the pet store, go online and buy the toys with the long skinny legs and let them, and they'll find their own way. Like if they're swimmer puppies, they're more comfortable up off of that flat surface. So you don't have to put them on it. You can start putting them on it, but they're very quickly, even when they're little tiny 2-day-old babies, will very quickly find their way to that support of those long skinny toys.
That makes a lot of sense. And then I've got a question here. Would an air purifier help reduce the risk of URIs?
Probably. So yeah, there's some good ones on the market, but choose well because there's also some that probably don't do anything at all.
Yeah. And then I just wanted to clarify, the slide that you shared said 15% off orders of 99.
The text, if you decide that you want to do any texting with us, we can keep you updated with all the newest and the best information for you by text message. And don't forget that we are on social media, so we have lots of access to that. We have materials there for you. So thanks for coming, everybody. This is our complete line of products, and we're happy to help you out. We've got great phone staff, so please give us a call if you have any questions. And if you have questions for me, they'll get back to you with information on how I can reach you. So please let us know if we can help you out.